Already gave you the time and the place, so don't be shy. Just come be the man I need. Tell me you got something to give. I want it. I kinda like it when you call me wonderful. Whatever the type of talk it is, come on then. I gotta know you're meant to be the man I need. Talk to me.
All right, well, good morning. Today is post-op day 0. We are getting ready to go back to the operating room. We're going to be doing an endoscopic approach for her brows where we lift the medial and lateral brow. We're going to be working on repairing some of the asymmetry that she has. Her right brow sits a little bit lower than her left. We're going to be doing a conservative upper lid blepharoplasty. Give me a big, big smile. We're going to be doing an open lower lid for her just because of the redundancy of skin that she has there. And also, when we get a good mid-face lift, you'll notice that that contributes to a little bit of bunching there. So having the option to remove some skin is going to be really valuable. Extended deep plane facelift. You turn your head. We're going to be doing a structural neck lift where we address these salivary glands. You can see that guy sitting nice and low. Digastric muscles, pair that with a platysmoplasty. We'll be addressing these jowls. Might even do a little micro lipo if we need to there. And then that extended deep plane facelift. So she is gonna look beautiful when we're done. We're gonna do a very conservative little lip lift for her, and then some fat grafting, focusing on temples, and then we'll do some nano fat, which doesn't add volume, it just helps with skin quality. We'll be doing that around the mouth and eyes, and then pairing that with the laser resurfacing. Are you so excited?
So excited.
Yeah. All right, well, good morning. We are here on post-op day 1 after a literal full shebang. We did an endoscopic approach brow lift, upper lid blepharoplasty, an open lower lid blepharoplasty, extended deep plane facelift. We did a really aggressive structural neck lift where we trimmed glands, we trimmed muscles, we did fat. Her before and afters are going to be so exciting to share. And then we did a nice little lip lift on her. So she has hemostatic net in because she was kind of oozy during surgery. We've got our endoscopic approach brow lift incision. She has ointment everywhere. I do the foam tape, as I had mentioned to everybody this morning, just to help keep the swelling posterior, to keep her from getting bruising around her eyes. She's got tape here to support the lower lids while she's swelling there to not put tension on the incisions. She's got her drain here. Everything looks lumpy, bumpy, swollen, bruised. You can see where we did the really aggressive laser around her mouth, and she's doing a good job slathering ointment everywhere. All of the kind of lumpy bumpies, folding, all of that stuff settles down. But this is kind of a really appropriate day 1 looking rough. That's something that you think that kind of surprised you or that you weren't expecting after surgery?
So a couple of things. I'm having high blood pressure, and I've never had that in my life. So that really surprised me. But then also, I love coffee. It's my routine in the morning. And so I didn't realize the headache that I would get from not having coffee. So
that's very common.
difficult.
And we have patients not drink coffee afterwards. One, because it can raise your blood pressure, and with her, we're already kind of managing a little bit of higher blood pressure, and we'd like tight blood pressure control after surgery to prevent bleeding and those kind of things. But also, when we want you to sit still and relax, drinking a cup of coffee can contribute to feeling like you need to get up and do things when we want you relaxing. So that's a really common thing. Usually about a week to a week and a half in, we might clear you for some decaf coffee that has a small amount of caffeine in it that can help. So that is definitely a common
answered
concern.
my question, because I was going to ask that today, if I could have decaf coffee.
Yeah. So you can have decaf probably in 2 or 3 days from now. Probably after we get the drain out, we can go from there. And that's more just from doing that manipulation of those salivary glands that were a little bit pickier on that end. So I'm going to show you guys with her. We did that endoscopic approach brow, so she has the lovely foam tape that everybody has opinions about. The 2 little stab incisions up here where we approach with the endoscopic instruments, the lateral brow, which has ointment on it, facelift incisions back here, all the lumpy bumpies from swelling. She still has her hemostatic net in because she's been a little bit oozy, some swelling in the submental region. You can see her lip lift sutures, upper and lower bluff sutures are all still in at day 3. And then because we did a structural neck lift, which is where we manipulate those salivary glands, we have a little drain in that'll come out in probably about 2 days. But when I show you guys her befores and afters, it's gonna be stunning. All right, we are here on post-op day 5. And this is we're doing our series of 3 patients, and everybody's been commenting on our first 2 patients not even looking like they've had surgery done. So this is our patient who has bruising and swelling, and to show you that every patient's journey is different. Today, we were able to get out her hemostatic net sutures. We put a little tape here to help with some of the swelling. You're gonna have the majority of your swelling from post-op days 3 to 5, so we're seeing that with her. We were able to get her upper eyelid sutures out, a few of the lowers, and then just cleaned everything up. She still got some sloughing here from the laser, so we put some more Aquaphor, and she got out and about and moving around a little yesterday. How are we feeling today?
Good. Yeah, it was nice to get out and go for a walk yesterday in the mall, and went to the grocery store and got lots of funny looks. That's okay. And yeah, no, I ate. My appetite was really good yesterday, so I felt like it was kind of back to normal. Yeah,
good.
So I feel good.
How's your pain control been?
Good. Yeah, I can't remember when I took Tylenol last, but yeah, it's better.
Doing really good. All right, I'm gonna just show you guys around on things. This is where some of that lumpy bumpy is. We got some kind of tethering here. This is all gonna settle down as the swelling comes down. Some more swelling in the submental. You can see a little swollen around her lip lift, laser site. We're gonna keep her drain in for 1 more day, get that out tomorrow. But in general, this is what one of our rough, looks like she got hit by a bus patients looks like. You can see how the bruising's also turning kind of green, yellow, coming down her chest and neck. Very, very common, but still she is feeling good, doing good.
So this is post-op day 10, and I am what we lovingly refer to as the train wreck patient. That I've had a few complications along the way, and latest thing is I've just had a lot of swelling under my neck. That could be partially due to the net that was removed and just everything draining down and then kind of sitting. And then I also have an allergy to a medication that is in the same family as a medication that I was taking. So we also think that may have been a contributing factor to everything. But I feel like I'm taking a turn on the mend. I can't believe how great my sutures already look in my eyes. My eyes look great under my nose, from my lip lift, where they were is already looking great. I can't believe it's only been 10 days. I should get some additional sutures out along my ears tomorrow, up in my hairline, and, well, not in my hairline tomorrow. Actually, they'll take the tape hopefully off tomorrow of my forehead, or Sunday, not sure. But yeah, just coming along. Been spending a lot of time in the hyperbaric chamber, which I've enjoyed, and just trying to recover and repair. And I cannot believe the exceptional care I've gotten from Dr. Pennington and her wonderful nurses, Haley and Heather. They have just taken the best care of me. I feel like family. And I traveled here from Utah to have surgery, and I have absolutely no regrets. I would do it again in a minute. Already happy with how things are looking, and it's only day 10.
We are here with Lori. We're about 2.5 weeks in. She was scheduled to leave about 14 days post-op, and she's having a post-operative complication. When that happens, sometimes it requires schedule adjustments, and so that's something where she has pushed her flight back. We're managing the complication. This is not one that I see often, but it can happen. And she had a little kind of fluid collection infection that happened at the front part of her neck. We were able to culture the fluid, drain the fluid, and now we're doing some wound management. It's something that she could technically do at home alone, but I prefer to be very hands-on and kind of help her with this process. And so we are doing daily wound care, we're doing hyperbaric, and just kind of touching base. And when you have a complication, it can be a little bit of a downer situation where, you're excited to have this new face and you're ready to kind of move on with the process. It prolongs the healing phase, which is a frustrating process in general, especially for patients like Lori that are super active and used to being social and involved and working out, and me forcing her to sit still and eat low salt has been challenging. So how is this process going for you in general, because it's not kind of the planned pathway?
I feel like honestly at first it was, because it is so unexpected, it was a little scary, but you've been there every step of the way with me. And so I think having that support every day, I see you every day. So having that support
every day.
Well, no, and Haley and Heather.
Yeah, it's a team.
There's a huge support system here. So that's what I've appreciated the most. And then just helping me through it. Really, I wouldn't want to be at home because I wouldn't feel comfortable managing all of this, but also just having the support and letting you know it's going to be okay.
Yeah, good. Well, and it's something that, because she was here, we were able to catch it early and we were able to manage it in a way where it's not going to affect her long-term results. And so that's part of why when I get patients asking, can we leave at day 7, can we leave at day 10, my preference really is day 14, because if you're going to have an issue, it's going to arise in those first 2 weeks, and then we're able to manage it. If she had gone home at day 10, this is something that potentially we wouldn't have caught, and she would be in a situation where some random doctor that's not one that her or I picked would be managing this and could compromise results. And it's also part of the process of when you pick a surgeon, you pick them because you want them to be the one that helps you manage the complication and make sure that you have the best possible results. So we take that part very seriously, whether you're in town, out of town, whatever. But it does require both parties kind of being flexible and making sure that we're in it together to get you the best results.
Thanks everybody for following along on my facelift journey with Dr. Pennington. I am now 12 weeks post-op, so I wanted to give a little update on my healing journey. When I agreed to let Dr. Pennington post my results on social media, I never dreamed that I would have the complications that I ended up having throughout the facelift process. The first day, I actually developed high blood pressure, which I've never had before. And my sutures were really oozy as a result of having really thin blood. So Dr. Pennington dealt with that in the operating room, and then obviously subsequently after that. Then post-op day 10, I actually developed an infection right here under my neck. Ultimately ended up having to be drained and then sutured, and then it was actually packed for about a week. So every day I would go in and Dr. Pennington would change the packing and manage the wound for me. It was a really scary process going through all that. But Dr. Pennington, Haley, and Heather always made me feel so much more calm and so much more hopeful about everything every day when I go in. I don't think there's many surgeons or doctors that would ever, after you have surgery, see you every day. So she saw me even Saturday, even Sunday. So I just don't think that there's many surgeons that would ever take that much care and time with their patients. So I can't imagine having gone to a different surgeon. I'm so blessed that I found her. I came home at about 3 weeks post-op. That day was really hard. I'm gonna cry now because I cried that day coming home just because it was emotional to leave them. They became my family, my friends, and I was just so used to seeing them every day. But okay, I promised I wasn't gonna cry, but I always cry. Anyway, just want to be real with everyone and share what it was really like. When I got home, I actually continued doing the hyperbaric chamber, and I had done that with Dr. Pennington for a couple hours every day. I checked in with her every day. I sent pictures. I talked to her every day for an additional 4 to 6 weeks after I got home. And now I still check in with her 2 to 3 times a week to make sure everything's going well. Despite everything, I'm so incredibly happy with my results and my face. I look in the mirror and I'm so much more confident. I am just amazed. I look at my before pictures compared to my pictures now, and I just cannot believe the difference. And I feel like my outside finally matches my inside. People ask me a lot, what do you like the best? Well, I would say, first of all, my neck. I've never had a neck before, so you can see that I had a lot of glands before, and those have been taken care of. And I actually have a neckline. And I guess the second and third thing is I love my eyes. My eyes were super hooded before, and now I can actually wear makeup and highlight my eyes. And I had loved my lips. As the years went by, they just looked worse and worse. And I was so happy because now my lips again are how they looked when I was 40 instead of how they looked when I was 60. So anyway, I'm just incredibly grateful for everything, and I am just amazed every day at the care that I received from Dr. Pennington and Haley and Heather. And I tell people all the time, Dr. Pennington is such a rare thing to find, because not only is she a professional with surgery and as a surgeon and as a doctor, but she's also such a caring, kind, calming person. So I just love all of them. Thanks.